are there specializations within occupational therapy?
Well, yes, there are, but first I want to go over our actual area of practices identified. So right now, these are changing and growing as we're a dynamic profession. So the areas of common areas of practice are children and youth. So that can be anything from like an early intervention, infants who are born premature, often need extra care in that first 2 to 3 years of life to meet the normal development milestones, and we're there to help that. To school systems, any student who really struggles to participate in their educational environment, we can come in and help them do that. So really that, and then in addition to children and youth, we do health and wellness. And we do medical, we do outpatient, we do inpatient or acute care. We also do community-based, and community-based is where we're going out and more of a programming for the whole community, especially when we look at health and wellness. Bullying prevention is a big area that we work on. And we also have mental health, and that can be everywhere from inpatient, people who are having an inpatient stay, to those who go to a day program, to those who just need assistance being independent. Productive aging, so really looking at helping the more experienced people in life as they transition. And we're finding most people want to be independent in their own homes or own apartments as long as possible. So we are uniquely skilled to help make all those many modifications and changes, so they can be independent and live independently as long as possible. We also work with visual impairment. That's a new area, an area we're growing in. When you're talking about low vision, there's many modifications to the environment that can be made, and then we're really skilled in that area too. So those are some of the common areas. Some of the specialties, there's something called there's hand therapy. So a certified hand therapist is either an occupational therapist or a physical therapist who gets extensive training and an advanced certification on hand injuries, shoulder injuries, and how to treat them. There are those, you can get training in any area, advanced certification in any area of practice. They're being developed. So you can have a school system, you can get a geriatric. So those are some of the areas. When I find one of the most interesting areas actually work in industry. I had a student who worked for Bobcat Manufacturing, and she analyzed every single task of every job in the entire manufacturing warehouse, and everything on how much weight needs to be done, which muscles are involved, what cognitive process needs to be done, and she helps streamline the whole process. And when a worker is injured and then is on limitations, then they can find a job they can do and still be within their doctor restrictions.
Wow, that's really cool.
Yeah.
I can imagine, especially in jobs like manufacturing where there's so many different things going on, and especially like a physical piece to it. Unlike us, like, desk workers, you have to be able to type. So, that's just one kind of adaptation that would have to happen.